we do not want to spend any more overall for healthcare. So what does that mean? That means we have to produce the funds you need to create a universal coverage. That has to come from the savings. To fund everyone to a standard benefit package, that fund has to come from savings. So that's the second parameter. The third parameter is there's no overall cost increase for employers and for workers. That's another parameter based on our analysis. Fourth, there's no reduction in net income for your providers, like the hospitals and your physicians and your other health professionals. They will not, they are already operating on thin margin, and like the hospitals, and there could not be any reduction in their net income. And the fifth one is we have to use a reform the payment system to move you to an integrated delivery system, because that's specified in Act 128. You can put out a vision out there. You want an integrated delivery system. But how do you do it? I can tell you around the world, we only discover what effective means. It's change the payment system. And to make the providers voluntarily want to integrate their health service. Then last but not least, we want to assure the elderly and the permanently disabled people, we will not and do not recommend a change in the Medicare program and the benefits that Medicare beneficiaries receive. Because if that change that would require an act of Congress, but that also could make the elderly and disabled people feel, gee, what are you taking away from us? So we want to assure the elderly and the permanently disabled people we will not disturb their benefits. But we would unify the payments paid out and the Medicare into one single pipe. So then let me go to then what could be saved. So we then move on to first, let's see how much can we save for Vermont. And here's a list of different savings can be produced that we recommend. One is, of course, administrative costs. Second is to reduce the waste and abuse in the current healthcare delivery system. And we support the effort and the foundation you already put in place, the Vermont Blueprint Plan and the medical home. We think it's a good foundation upon which you build an integrated system. And that will produce some savings for you. Another savings you can do is tort reform. And that's why I have many friends who refuse to return my calls, and these friends are trial lawyers. And then you can produce savings in the longer run through an integrated delivery system. But that would take maybe 12 years to work that. And then last but not least, which I'm going to explain a little bit later, you can change the governance and the operational structure of your insurance system. Before I turn to some numbers and graphs, I want to make clear to everyone the simulation models we have undertaken. We rely on Professor Jonathan Gruber of MIT, which has developed the best simulation model, and that's used by Obama administration as well as by many states, along with the regional economic model that's employed by Nick Rocker, who is here. That's a model used in your budgetary process. We rely on these models to estimate what's the impact. But these models are only tools, just like predicting weather. It's not, you cannot guarantee 100% snow or sunshine. You can only give a probabilistic range. So what you're going to see in the numbers we present, I hope you bear in mind, the numbers is a point estimate, but the margin of error could be plus or minus 15%. And some of these numbers, the margin of error could be 20%. So do not treat this as something certain, because we have to make many assumptions, and also the model can only model certain aspects but not others. Then let me show you what savings could do for you. This graph, the top line, is what happens if there's no reform. Vermont does not have to do it, will not do anything. Just continue your current path. That's the top line. If under the option 1, that would, how much, the one-time reduction, you see the line drop sharply. Within 2 years, if you implement what we recommend, we assess that you will be able to see a sharp drop in your health expenditure under the current benefits, okay? We're not talking about spending that money yet. Just if you just do that, how much savings you can produce under option 1, 2, and 3. The next slide gives you a percentage and the possible savings. You see, the savings could be as little as 16%, and it could be as high as 25%, depending on which option you may, in your wisdom, you decide to adopt. In terms of dollars, the savings could amount to $300 million or so, up to about $550 million or more, depending on the different options. So that's the range of savings. But we want to produce a savings to have everyone covered by insurance and bring the underinsured people up. Next slide. So we have to, there will be 32,000 people remain uninsured after PPACA gets implemented. We have to give them insurance. We have to bring, as I said, the underinsured to a standard. We believe you can use part of the savings to expand the vision care and dental care. And under the comprehensive plan, we can look at, you can cover nursing homes and home care. but then we have to look at how much will that cost. The insurance program only affects the demand side equation, that is people's financial ability to seek health care. But we have to make sure that services are there on the supply side. Vermont has some shortages of primary care. A few of your community hospitals need updating. There needs to be investment for this. So part of the savings we say we can produce has to be used for these purposes. So the next slide gives you what we propose to use the savings. Just to cover the essential benefit package, that is the one without nursing home or home care, and only some expansion of vision and dental care. You see, to cover the uninsured may cost up to $190 million. To bring up the others who are underinsured could cost up to $70 million. And to provide something for dental and vision care, like dental care for children, eye examinations, that could cost up to $100 million. And then on the right-hand side, you see how much it will cost if it's a comprehensive package. That you cover everything without much cost sharing. And you also include the nursing home or home care. If you add up these numbers, the essential benefit package will cost you a little bit more than $400 million to do. The comprehensive benefit package will cost you more than $900 million to do. More than the savings we can produce for you. Consequently, we say the comprehensive package is not affordable right now. Vermont should go for the essential benefit package. Now, when you realize these savings and you find you still have extra, then at that point you can contemplate expanding your benefit packages for home care and nursing home. Again, next slide, I want to emphasize that this does not affect the Medicare population. No change for the Medicare population. Then you may ask, how do I pay for it? We recommend that you finance the single payer through a payroll contribution. But we will exempt the low-wage employers and the low-earner workers, because their ability to pay the payroll contribution will be very limited or non-existent. But the payroll contribution, which the rates are shown in the later graph, later tables, we assure that employers will not pay any more than what they're paying now in premiums. Most workers will not pay any more than what they are paying in premiums. This is our guiding line.